I'm a specialist working in the intensive care at Stollery Children's Hospital. My role ends up being that if there are children that are critically injured or need specialized support after an operation, they end up coming into my intensive care unit here at Stollery. And I'm part of a team. I lead a team of doctors, nurses, respiratory therapists, and work along with surgeons and other people as part of a cohesive group trying to provide the best care for children. Every year we end up having 800 to 900 children come into intensive care at Stollery. With the care provided, we're able to get the vast majority of those kids through the ICU stay and ultimately home. And that actually works out to about 96% of kids that we're able to make a big difference for, and they survive. Unfortunately, what happens is there's 3 to 4%, which ends up being about 30 to 40 kids a year, that despite a lot of people trying to do everything they can to pull those children through, they don't make it. And we do end up losing those children. We see a lot of things in intensive care that are tragic events. Unfortunately, what that ends up meaning is that those of us end up getting a little neurotic about those things that can go wrong. And that's those things that can go wrong with our own children as well. As my children ended up growing up, and they're all grown up now, they're adults, there were a lot of things that I was super sensitized to, that I said, no, I really don't want you doing this or doing that. And the reason for that is that I was thinking back to those bad things that had happened, that I'd had to look after those kind of children in the intensive care. As adults, they say, yeah, we understand what you do for a living, Dad, and we understand why you're neurotic, but you are neurotic. I think one of the difficult things that we all face in the intensive care looking after sick children is that a lot of the time it becomes very easy to become focused on a disease, focused on numbers, focused on lab values. And the risk always ends up being that we end up lose perspective that underneath those sheets is a child, and next to that child is a family there that cares a lot for that child. And I think that one of the challenges that we face in intensive care is maintaining that perspective, that it's about the child and it's about the family, and not getting lost in the forest for the trees. We end up putting in place these mechanisms to protect ourselves, but at the end of the day we have to be there to support children and families with all the empathy and sympathy that we can.